Welcome everyone, and thank you for the opportunity to present our QA project titled Reduction in Foley Catheter Days via Implementation of Foley dot phrase and Internal Medicine Resident Documentation. My name is Aamer Ubaid. I'm a second-year internal medicine resident, and I'm one of the team members on this project. Catheter-related or associated urinary tract infection are considered to be the fifth most common type of healthcare-associated urinary tract infections. Around 15 to 25% of hospitalized patients get a urinary catheter placed. And among the patients who get diagnosed with a hospital-associated urinary tract infection, 75% have a Foley's catheter in place. It has been estimated that for each day of urinary catheterization, the risk of bacteriuria increases by 3 to 7%. The biggest risk factor for catheter-associated UTI is prolonged catheterization. Hence, timely removal of the urinary catheter is critical to reduce the risk of hospital-associated urinary tract infection. Fortunately, there has been an overall 8% decrease in the incidence of catheter-associated UTIs between 2018 to 2019 from the national database, coinciding actually with 7% decrease in urinary catheterization overall. The aim of our project was to reduce the average number of Foley catheter days among internal medicine inpatients with the implementation of a Foley dot phrase to prompt internal medicine residents to evaluate and discontinue Foley catheter whenever it's appropriate. The methods adopted for this project included that with a collaboration with the IT department, a dot phrase will be established, which was named /Foley, for residents to use in clinical documentation. This dot phrase will auto-populate the date of insertion, date of removal, duration of catheter, and indication for Foley placement. Internal medicine residents were provided education about our QI project and the interventions via Zoom lecture and through email. The Foley dot phrase was implemented on March 1st, 2022. As a part of the inclusion criteria, only internal medicine primary patients who had Foley catheters in place during their inpatient stay were included, patients not on internal medicine primary service, and those with chronic indwelling catheters were excluded. IT department was requested to provide 3 months of data pre and post dot phrase intervention. Additionally, data on the use of dot phrase was also requested. Our results showed that before the dot phrase was introduced, the total number of Foley catheters inserted by medicine teams that met the inclusion criteria from December 1st, 2021 to March 1st, 2022 was 52. The average number of days between the insertion and removal was 6.2 days, and the range was from 1 to 26 days. The most common indication for Foley catheter placement was recording Eckert intake and output, which represented almost 65% of the total catheters placed. Also, 23% of the Foley's placement were for indications like neurogenic bladder, acute urinary retention, or urethral obstruction. Unfortunately, by the time this poster was published, post-intervention data was not available yet, but it has been requested. In conclusion, we can say that the biggest risk factor for catheter-associated UTI is prolonged catheterization, and it is really critical to remove the Foley's catheter in a timely manner to reduce the risk of hospital-associated urinary tract infections. From our data, we found that the major indication for Foley's placement was accurate intake and output recording, and the average days of Foley's placement was 6.2 days. Despite unavailability of post-intervention data, which is one of the limitations of our QI project, in addition to a small sample size, We do suggest that continuation of the dot phrase will help reduce Foley catheter days and subsequently catheter-associated urinary tract infections. Thank you. Data